Chemotherapy is an anti-cancer drug treatment which works by killing cancer cells. So there are a number of reasons why children with cancer are given chemotherapy. So doctors can give chemotherapy as a treatment on its own if the cancer is particularly sensitive to it, or chemotherapy can actually be given before surgery, and that is to try and make the tumor smaller so that the child will require less surgery and it will be easier to get all of the tumor out. In order to understand why chemotherapy causes side effects, I think we need to understand first how chemotherapy actually works. So chemotherapy works by killing cells that are dividing, that these cells that are in the process of splitting into two new cells. And in cancer, we have cancer cells that continue to grow and divide to form this mass, a lump that we call the tumor. And this is why chemotherapy, when injected into the patient, will go on and kill the cancer cells. However, it also will affect and kill any healthy, normal cells that it's in the process of dividing. So for example, these are cells in your bone marrow or in the hair follicle. And so it's the killing of these healthy dividing cells that will go on to cause the unwanted side effects. So different people will react to chemotherapy differently. However, there are some short-term side effects that are very common. So these include things like some of all of you have to fall out, and that is because, like we said, chemotherapy affects cells in the hair follicles. During chemotherapy, you see other side effects such as an increased risk of infection, an increased risk of bleeding and bruising, and also it can lead to anemia.
The treatment's pretty brutal, particularly the first 8 months are really tough. Their immune system's completely wiped, so as alongside all the chemotherapy, you've got the constant risk of temperatures and picking up viruses, and all that also weighs on your mind.
It was horrid having all that medicine and stuff, but the doctors and Mummy and Daddy keep saying, if you have it, it will make you better.
Although most chemotherapy side effects are short-term, unfortunately there are some that can be long-term. Some chemotherapy can also affect fertility, that is the ability to have children in the future. And another long-term side effects of chemotherapy is a small risk of getting a second cancer in the future.
We know potentially she won't grow to the full height that she should. We know that there's a very good chance that she will never be able to carry children. But in future, we just don't know what else is going to happen. So if treatment could be found that is not so harsh and it's not going to affect the body quite as much and quite as badly as it does at the moment, that would be incredible.
Immunotherapy is a relatively new type of cancer treatment which uses our own immune system to fight cancers. So what immunotherapy gives us is basically gives us the ability to teach the immune system to recognize these cells so that the immune system can go on and kill the tumor cells. In contrast to chemotherapy, which is systemic treatment and affects the whole body, immunotherapy is what we call a targeted therapy, which means it is designed to only target cancer cells, leaving healthy cells unaffected. So this means that with immunotherapy, we will have fewer and less severe side effects, as the healthy cells will not be as affected as they are with chemotherapy. My research project is currently fully funded by you guys, by Children with Cancer UK. So a massive thank you to you and all your supporters for all you guys do.